Hi, I'm Dr. Amie Bend, and I wanted to talk to you about some of the results of taking statins. Statins are a common part of our society. Many patients in America over the age of 45 are on a statin. A statin is something that you are familiar with and probably have been taking them for years if you're watching my video. Basically, there's three things that happen when you're on statins for a long period of time. One is your CoQ10 gets decreased, two is your vitamin K2 gets decreased, and three is your selenoproteins get decreased. So that being said, when your CoQ10 goes down, it really reduces the energy cycle of your body. CoQ10 is a chemical that's also, it's upregulated to something called ubiquinol. When you're 25 and younger, your CoQ10 converts automatically to ubiquinol, and it just is a more functional version of the chemistry. It is there to create all the energies of the vitality aspect of creating all energy for all cells of the body. So when you reduce your CoQ10, you're increasing your chance for disease because your body's not properly making new cell energy. So it'll affect your body's energy. And the paleocardiologist book by Dr. Wolfson, they also mention CoQ10 being a key factor and a contender in your ability to resist when you have a cardiac incident. So if you have more CoQ10 in your body, you may reduce the chance of dying by 50% because your body's cells are going to be able to recover from the cardiac event more readily when you have enough CoQ10. So it's a really good contender in the prevention of cardiac death. So it's not a guarantee, but it reduces your chance by 50%, which is a pretty good number. That being said, you want to get good sources of CoQ10, and you want to supplement by 200 to 300 milligrams, depending on the research study that you're looking at, to compensate from the statins that you may be taking. The other item I wanted to talk about is your statins will reduce your vitamin K. Now, there are people that are taking certain types of statins like warfarin that are told to stay away from vitamin K and all forms of it. So make sure you're consulting with your medical doctors. But if you are someone that's not in that category, vitamin K is very helpful in preventing you from having your calcium bind to your artery. When you take statins, you're increasing your calcium, and you're also increasing your chance of arterial sclerosis. So when you take your vitamin K, a high quality of vitamin K supplement, you will reduce the chance of arterial sclerosis. So that being said, you just want to look for high quality K2 supplementations. Now, the third thing is your selenoprotein, and I very simply know that most people know that glutathione is an antioxidant that fights free radicals in your body. And the common buzz in research is that the more glutathione your body creates or has, the healthier you are, the longer you're going to live, and the healthier you're going to live. What you don't know is that selenoprotein is a critical aspect of the glutathione doing its job properly. So you need to have the right amount of glutathione functioning, and if you don't have selenoprotein, you will not be utilizing your glutathione, or it won't be functioning at its highest level. You get selenoproteins from just vegetable use. So if you just eat more vegetables when you're on statins, it's going to help offset the side effects of having statins. Now, there's much more details involved with these supplements. This is a very general video. You are, of course, supposed to be following whatever your dietary guidelines are made by your medical practitioners. This is meant for people that have been on chronic statins and they know that it's okay for them absolutely to take CoQ10. They're not on warfarin because those people can't take vitamin K2, and most people can take vegetables. That's certainly not going to hurt any normal person. So if you have any more questions about this, I'm Dr. Amie Bend. I practice in Arroyo Grande, California. Just wanted to let you know that those statins have side effects, and there are some ways you can offset it. Give me a call if you have any questions. Thank you.